Gavel hit I've ever heard. There you go.
Good afternoon. Appreciate y'all being here today as the meeting of the Tarrant County Hospital District Board of Managers meeting. We will start this meeting at 1:05, and we will open with our opening prayer, and I would call on Reverend Leanne Franklin to come up and please give us that, and if you'd please join me in a pledge of allegiance following that. Ms. Franklin.
We gather together, grateful for this time to do good. So let us focus on what really matters. Let us be united in mind, in heart, and in spirit, and let us never for 1 minute forget the privilege that it is to serve all of these communities and to do our best for them every hour of every day. In your holy name we pray. Amen. To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Leanne, thank you very much. The next order item is on agenda number 3, citizens wishing to address the board. I believe we've had a few people sign in. While council's bringing that, I will just remind everybody our standard operating procedure is each speaker gets 3 minutes. If there is a group of individuals speaking about the same thing, we would ask you pick someone to represent that group. So the first individual I have is Catherine Lawrence Ireland. Ms. Ireland. And for your convenience also, there'll be a 3-minute clock that'll start here in just a moment. And again, just so we kind of keep that so everybody gets the same length of time. So the floor is all yours.
My name is Catherine Lawrence Ireland. I am with Physicians Committee. We're a nonprofit group of 12,000 doctors. 579 of us reside in Texas, and I live here in Tarrant County in Keller and own a business in South Lake. Thank you for the opportunity to comment today about the food environment here at JPS Hospital. Many people look to our local hospitals for guidance on adopting a healthier lifestyle, but that also includes good nutrition, right? So JPS can help to prevent diet-related diseases like diabetes and heart disease, which plague our community here in town in Tarrant County. But there's one change that I'd like to ask the board to consider making. On the first floor of our hospital here, a McDonald's restaurant offers cheeseburgers, chicken nuggets, and other foods that aren't so health promoting to visitors, patients, and even our hardworking staff. So Physicians Committee obtained the hospital contract with McDonald's, and it ends next month on August 16th. As you know, there's an item on the agenda today relating to that amendment to the commercial lease agreement between JPS and McDonald's. And if the fast food contract ends and the amendment set aside, JPS could instead partner with a vendor that offers tasty and affordable plant-based meals to help our community get more nutrients and fiber and help our residents prevent heart disease and diabetes as well. Now, I know this from my own personal experience with heart disease, high blood pressure, high cholesterol, and extreme reproductive disease. And incorporating more nutrients and fiber into my diet through plant-based meals helped me to reverse it completely. And health food is not expensive, like a lot of people think. Other hospitals have done this, and they found that vegetarian entrees cost about 50% less than those that are meat-based. And they're saving about $5,000 a year in expenses as well. Several other hospitals in our region have already closed their McDonald's. So one of those is Parkland Hospital in Dallas, Ben Taub Hospital in Houston, and Grady Hospital in Atlanta. I just want to leave you with some quick numbers. A recent study in the Journal of Circulation published, what they've concluded is that by a person eating fast food just 1 time a week, they're at 20% higher risk of dying from heart disease. And when a person eats fast food 2 to 3 times a week, they have a 50% higher risk of premature death. As a nutritionist, I've worked with over 8,000 patients here in Tarrant County, and I've seen firsthand the power of plant-based meals in preventing and reversing heart disease. And I hope that we can do something like that in our community here. Thank you for your time, and God bless.
Thank you very much for the comments. The next person I have who signed in is Kelly.
Good afternoon. My name is Dennis Killey, K-I-L-L-Y. I live at 1614 Oakwood Lane in Arlington. I'm all for choice, and that's what this is all about, is choice. I'm all for closing the McDonald's downstairs and replacing it with a Whataburger or a Burger King or a Wendy's. You know, that makes a lot of sense because people hate to come to hospitals to begin with. I hate to go to the hospital. There needs to be something in the hospital that makes people feel better, and eating food makes people feel better. You know, if you're going to close the McDonald's, I would recommend that you shut down all the elevators in the hospital and encourage people to walk up and down the stairs. That's a healthy thing to do. I encourage people, or you also, to close your parking garages, because it's much better for people's health to walk to the hospital than drive in a nice, cool car. I read the article in the Star Telegram, the liberal-leaning Star Telegram, and I had to come up and talk to you about this. It's about choices. You know, what you can do is you can put a sign in front of McDonald's saying, more diet-friendly offerings can be found in JPS cafeteria. That makes a lot of sense and gives people a choice. Don't take choices away from people. That's happening too much in this world today. Thank you.
Mr. Kevin, thank you very much for your comments. The next individual who signed in is Ms. Amanda Morrow, if I said that right.
Yes.
Good afternoon.
Good afternoon. Hi, my name is Amanda. I wanted to say thank you for giving me the opportunity to speak today. I am familiar with the PCRM, but I came here on my own as a representation of the citizens of Fort Worth. I live in Fort Worth currently, and I own a plant-based meal prep company called Plant Set Meals. And I wanted to talk to you today about the McDonald's re-signing, the lease re-signing as well. I am a certified personal trainer as well as a business owner. My story is not only personal, it is also for the health of Fort Worth. My father here was treated in 2016 and 2017 with leukemia. Now, yes, there are choices here to have healthy options or McDonald's, but the reality is the first thing you see when you walk in to the hospital is McDonald's. I didn't even know that there was a cafeteria in the bottom floor for 2 months. My father was here for 3 weeks to 4 weeks at a time and would go home for a week. Okay, so when that, as a person coming to visit a sick person, is the first thing they have to walk past every day to get to the elevator to see their sick father, is not a good representation of health. You have a responsibility to this community to represent things that help with health and healing people who are sick, okay? Now, recently, the Blue Zones Project was initiated in Fort Worth, and we became one of the biggest cities in the world to be a Blue Zone certified project city. Having a McDonald's in this hospital is the exact opposite of that initiative. And I understand McDonald's is affordable to many people in this community who have low incomes. I personally did not grow up with a high income advantage to me. And I know what it's like to maybe have to order something off the dollar menu. I urge you to look into different options that could be provided to people by plant-based vendors, because they can be the same prices as what McDonald's is providing for people. Other cities or other states have already made the initiative to make plant-based options very important and very required for their people who are coming in to get help. Take New York, for example. It is now a state mandated thing that they have to have plant-based options in their hospitals. And I want to leave you with this. Texas is supposed to be bigger and better. Let's create an example of this in our communities. It is imperative for our city and our nation that is growing with more diseases every single day. Thank you.
Smart, thank you very much. The next person signed in is Mr. Carlo Capra. Oh, Carlo, I didn't see you over here. Yeah. I didn't see you outside.
Thank you, Mr. Chair, and thanks to the board. My name is Carlo Capio. I'm a local business owner here in the North South Side. I own a business called Z's Cafe and Catering. And over the past 11 years, we have put 138 low-income men and women back to work through our program. So we have an MOU with Samaritan House, which is your neighbor right down the street. And what we found is when you put low-income people back to work, you give them a chance, not a handout, but a hand up, they will need less medication, they'll have less doctor visits, and they'll use the hospital much less, leading to a healthier life. Coincidentally, all 138 of those employees that we've employed are patients of JPS. And so what we found there is really remarkable. And I read that Star Telegram article a couple days ago, and it got me thinking, because one of the other things that we do at my business is we support local chefs. And believe it or not, Amanda is one of the 75 chefs that rents our kitchen. And I thought, what if instead of a fast food establishment, what if they took a local chef and put them in there? I know how to help design programs to support and get low-income men and women back to work. Now that's a narrative, isn't it? Instead of the county hospital having a fast food business, it's a county hospital supporting local entrepreneurs. It's creating jobs of the very patients that they serve. And it's changing the narrative of what they're talking about in the news. So my question is, would JPS consider putting one of our experienced chefs who may not have a brick and mortar kitchen or location and partner to create jobs for folks that are using your facility now? Because the likelihood of them coming back would be reduced frequency in their visits here. So just something to think about. I think I've got 3 or 4 other Amandas that are all-star chefs with affordable, healthy, delicious food that are very good business owners, and we mentor them, and I guarantee you with that kind of partnership, it's worked with Samaritan House for 11 years, and with this kind of partnership, I really think it's something special that you could do to really change the whole face of what you're doing and to destigmatize the very people that you're serving here, to get them in front of people, job skills, and back on their feet and back to work. Thank you.
Carlo, thank you very much. Thank you for what you do in the community. I have no one else signing at this time, so therefore, again, appreciate everyone's comments. I think the next order of item will be number 4 on the agenda is the approval of the minutes. The June 13th minutes provided previously to the board. If there's any questions, we'd certainly address them. If not, I'd entertain a motion. Reverend Emerson's already made the motion for approval. I have a second, but Dr. Weber. All those in favor say aye. Thank you. At this time of each month, I guess I'll, says any action or any comments I'd like to make. I just have 2. One is I actually had the pleasure of attending yesterday the breakfast that kicked off the TC, I guess it's called the UNT Health Science Center TCU Medical School, but 60 new medical students that will be attending that school as they now started. And it was amazing. I had my JPS pin on, but it was amazing just how many of those young students, and they're in here from all over the United States, how excited they were. And they already knew about JPS. In fact, I think, get ready, they're coming over, I think they said next week, Robert, for EPIC training or whatever. And I thought you might, yeah. And so again, they were very excited about JPS. So again, just one more element within the community that is going to be supporting the ongoing what we do here at JPS with our teaching hospital. So I thoroughly represented that on behalf of the board and was glad to be there. And the only thing I will mention from a business standpoint is we give out a lot of thank yous, but I'm going to take a moment here in my time to say thank you to Trent. You know, the last couple of months, there's been this question, well, what's happening since the bond passed? What are we doing? There's been ongoing meetings and obviously planning. Trent chairs planning, and he's been very involved, as many of this board on that committee. We had to kind of wait for the legislative session, learn about cap rates. That was the end of May. This is July. I'm happy to say, and I'll just go ahead and announce it, I think it's the July 18th meeting. Trent and I have spoken several times at 3:30. You know, we've got some new board members. We talk sometimes about the Blue Cottage Report or Boca Powell Master Plan and all this stuff that went on even prior to the Citizens Blue Ribbon Committee. So Trent, I'm not going to take your speech away, but if you wouldn't mind, I know that's coming up, but we're going to have an extensive, not only, so everybody can go to our websites and bring all that previous information up for those new board members that may have not been in the process as long as some of us been on this board for years. Not only doing that, but also give some direction on where we're going from there. Trent, you may want to add something else to it, but thank you. Trent has spent a tremendous amount of time, as many people on that committee have. There's a lot of committee chairs. You know, we're a small board because there's only 11 of us, but the reality is thank y'all for all your time. But Trent, thank you for all the work you've done.
Thank you, Mr. Chairman. You know, it has been a long time, it seems like, since these bonds were approved. And it seems like the larger the bond issue, the more time elapses between the time you can actually get something started. There was clearly a delay because of the uncertainty regarding the legislature. But even without that delay, this committee that is, and I don't call it the steering committee because we're really not making decisions. We're only looking at some of the elements that are going to have to be in place before we can begin deploying bond money. The intention of this committee has always been that whatever they agree upon would come back to the planning committee and then the board of managers and ultimately the commissioners court. So there's been good representation from the commissioners court at each meeting. And honestly, most of our work has been about process. It hasn't really been about when we start groundbreaking or what building we build first or, you know, which architecture firm. None of those things have really been on the table. The question has been, how do we go about making certain that as we deploy $800 million in bond funds, we have put in place a process that reflects the knowledge of what that will cost in operating dollars to JPS as we deploy those funds. So there's a myriad of opportunities that come up in that. We've talked about P3 opportunities. We've talked about the public-private partnership options. We've talked about what the dollars look like in terms of their deployment based on timing X, timing Y, timing Z. So this coming Thursday, as Charlie mentioned, a week from today at 3:30, we have a very important planning committee. And Dorothy and I've had this discussion, Ralph and I've had this discussion. One of the things that we want to be sure that we do is this committee now, I think, begins a new phase of work, is to make sure that we have very clear board input on what the board believes to be the priorities when it comes to deploying these bond funds. I think the Commissioners Court is very sensitive to what the board has done in the past on this issue. To Charlie's point, we have asked that not only the Blue Cottage report, but the HCA report, the Cummings report that was essentially the Blue Ribbon Committee, all of the Boca Powell study, all that work that this board has done over the past 9 years is going to be on the portal so that you can connect to it and read that. And I would encourage you before that planning committee to at least go back and look at that, because amazingly enough, there is continuity between how this first began and how it now appears to be heading. And that's good. And I think that's a reflection, honestly, of the due diligence of JPS, the staff and the board working toward what we knew were going to be the important items. There had to be community buy-in to that before the bonds could be approved. That was the Blue Ribbon Committee. Steve and I served on that committee. Now we're at the point of saying, okay, the community has expectations. The community, I'm sure, most people would love to see us go start tomorrow building a new tower. The question, though, becomes, knowing what we know, how do we deploy those funds in a responsible way that concentrates on not just the cost of operations, but what revenue streams will ultimately be realized from that, and how we can balance those new expenditures. Because as most of you know, all of you that have been on the board any time at all, what we spend in terms of capital is really minuscule when you consider what it costs to operate JPS. I mean, probably 7 to 8% of our budget ends up being capital. 90+% of our budget becomes programming and operations. So what this committee has done is say, okay, now we are past the legislative session. We've heard some alternatives about different ways of deploying contracts and how we might go about process. And now it's time to get board input on priority. And so at that planning meeting, we're going to have a structured discussion about what the board believes to be the priorities. And I don't expect anything in terms of revelation from what's already been done, but I do think it's time now to look very closely at what that Blue Ribbon Committee report said, and from at least a board perspective, create some expectation of priority with regard to how these bonds are going to be deployed. I believe that we can have construction underway if we are diligent and smart about the way we deploy this in 2020. I have very little doubt that we can have construction underway in 2020. But which project we select and that project decision relative to cost has got to be something that reflects this board's consideration and this board's input, so that we can then take that to the committee and say, here's what the board has suggested. And that way we have commissioners and board working toward the same direction as we take this to the full board and we take it to commissioners court. So please take the opportunity to go back and read some of the comprehensive work that's been done to date in terms of our campus plan, the recommendations of the community, the demographics. It's a lot of information. And then bring to the meeting next Thursday your thoughts on priorities and how you believe JPS should go about structuring this now in a very physical way. So we've made progress, even though it doesn't seem like it, Mr. Chairman. It's taken a long time, but I think we're at a point now we can be pretty diligent and begin moving forward quickly. But this is an important step for us.
Good. Well, Trent, again, I appreciate.
Mr. Chairman.
Go ahead. Yes, right.
Yeah, I just want to add to what Trent said. At our finance meeting, I'm reluctantly giving him credit, the finance chair.
No.
But Sharon gave us an outstanding picture. And I think it's important what she presented to us, and when you connect that, what we're going to talk about at planning meeting, it's crucial. I mean, I know I'm not chair, but it'd just be good if all board members were present at the planning meeting, because if you can go back and visualize what Sharon presented to us, then we look at setting those priorities, and as we talk about long range and the planning and the brick and mortar and all of that, whatever, I think it would be a plus.
Yeah, I agree. Well, I think it's a perfect timing, Ralph. Your comments are right on. I mean, we knew work was being done, you know, and again, I represent y'all because I'm in the community a lot, but as chair, it was almost getting to the point in time where, what are you doing? The voters went to the polls, and it was kind of like, are we doing anything? There was a timing and process going on. It's now time to bring that out. In fact, I was with Commissioner Allen this morning. And so, you know, again, she was here last month. And then we also had the issue with, obviously, with Amanda, with Zim coming on the board. We started talking about all this stuff that happened. Well, we had that report, and we didn't go through an orientation. We heard that loud and clear. So this is a way to start now, is really kind of collecting all that information together, giving y'all an opportunity to catch up, and then set those priorities, because this board will set those priorities, and then move forward. So again, Trent, a lot coming. Get ready to do a lot of stuff as we go forward. But again, I think those are all positive points we'll make. Trent, thanks again. And other than that, that's really my report. Robert, I'll know you'd like to give your report this time also.
You bet. Thank you, Mr. Chairman. For those that came to the board to speak, we are thankful and grateful for any input we have. Oh, my mic. Now you can hear me, actually. But I did want to let you all know we don't find it rude at all if you want to go about the rest of your day. However, if you want to stay for the entire board meeting, we have a prize at the end for you. But you don't have to stay, and it won't be rude if y'all want to leave. We understand that, and we don't take any offense if y'all want to come and speak at any time. And then after you speak, go about the rest of your day. But we do appreciate y'all being here. You know, we've made we made every attempt that we can possibly make to figure out how to change the culture of JPS, and I think we've done, with you as a board leading us, I think we've done a good job in the last 10 years to do that. One of the things that we found is when we would have what we call our LDIs, our Leadership Development Institutes, and some of y'all have attended those with us. We found sometimes cascading down through an organization with 6,500 people was challenging. So what we included was we asked members who were directors, managers, vice presidents, and senior vice presidents to look at people in the organization that we title as ambassadors, people that show that spirit of JPS, people that follow those 3 rules, people who own it, people who seek joy and are never jerks. And so we have that kind of attitude and approach, and we've brought those ambassadors together over the past couple of years, and that number now has increased to 300 people that we bring in for ideas, and that has allowed the situation at JPS to really cascade down and really get the attitude of who we are at JPS, what we represent to every patient that comes through our doors. And I wanted you as board members to know that that's the case, because you're probably familiar with our LDI, but maybe not our ADIs. And so we just had our last one where we had 300 folks show up, and we had a great session. Michelle Greenford talked a lot about inclusion and sensitivity, and the fact that if you want to work at JPS, everybody's treated the same way, and that's fairly, and it's with respect. We have the luxury of trying to make people feel better. We don't have anything else other than that. We don't make judgment calls because all blood seems to be the same color. It never goes into any other aspect. So that was a wonderful session that we had with 300 of our folks, and the surveys that they sent back indicated that they really appreciated the sensitivity training that we provided, and that shouldn't go unnoticed from an organization that's trying really, really hard to create 6,500 people that not only the best caregivers, but are all around great citizens for our community, and we're going to continue to work on that. Also wanted to let you know that the foundation has put together what they call cocktails and conversations. There's a lot less of the cocktail aspect and a lot more of the conversation aspect, but we've done 3 of these now, and unfortunately, people have to listen to me, but thank you, Mr. Montgomery. But we go out and we talk about what's happening at JPS, what we're trying to do, and we just concluded our 3rd one, and it was hugely successful. And so JR and Kristen Sullivan are now going to start having these throughout the county. Some of them have been more local to the hospital district, but I know that JR has been talking to folks up in the Northeast. And if you all have suggestions on how we can assemble 20 or 30 people who are stakeholders in the community to hear about JPS, we've heard from y'all as board members, we need to get the word out. Getting the word out also comes with a huge dollar amount. It doesn't cost anything for me to show up and meet with 20 or 30 folks and tell them about what's happening at JPS. I think it's helpful, and it's proven to be helpful in the 3 that we've had thus far. The turnout's been good, and the reception has been pretty overwhelming. So if y'all have ideas as board members where we should be having some of those, we'll be happy to have them, but we'll up the ante on those quite a bit.
And having attended those with you, you did better after you had a few cocktails.
Actually, the audience did better. I didn't have any. Yes, sir.
Can you give us an example of individuals who attended?
What we did was, the foundation, I think, did a really good job, and they found somebody to host the event, and we asked those hosts to invite their friends or the people that they thought should be there. So JPS didn't do the inviting of the people who were there. The 2 hosts did, or the 3 hosts, or the 1 host in the situation. And I think we've averaged about 45 people for each one. Would you say that's about right, JR? A little bit, maybe right around there. So we've had about that kind of turnout. It's just it lasts for about an hour if you include the talking, people mingling before and people mingling after. It's probably about an hour and a half, and they've usually been during the evening, at least the 3 previous ones. But they can be a breakfast, a lunch, an afternoon, whatever can be worked in schedule-wise. So y'all think about that. Those are great options, and they've worked really well. The other thing I want to do is, I don't oftentimes, we in the office, we get these every day. And sometimes we focus on a variety of things at JPS, and sometimes you're constantly trying to figure out what you need to be doing better. But I always tell the staff it's time to always take a breath and look at what you've done. I would encourage you board members to do that as well. Occasionally take a breath and realize how successful you are as a board and how successful you have allowed JPS to become. And when you get notes like this from people, it rocks you. It will change your life when you hear this. This came from one of our Connection patients, and he said, I'm 53 years old, and I've been in the JPS Connection system for over a year, and this is the first time I've been able to receive medical attention in my adult life. That statement is not only sad, but that statement is overwhelming to the power that JPS has in helping people in their lives and making sure. People don't sometimes understand that if you have a $5 copay, the power and the impact that means. Actually, it means I should be quiet because my mic went off. They did the same thing when I was in the legislature. It was a very similar situation. They just cut my
My
mic off.
system's working.
Yeah, it was just blinking at me. But the point is when you change your copays or you change the address to 0.5 miles down the road, what an incredible impact that can be to our patient base. And for a man to say, I've never received health care in my adult life and I'm 53 years old, you understand why you get up and come into work in the morning, and you understand why you go home in the evening. That's powerful, and he had good things to say about JPS, but the most important thing is I think you all as board members need to realize the power and the significance that you have. When we deal with all the tough issues we have, we changed a man's life, and he ended it by saying, thank you for making me healthier and thank you for giving me a better life. And that's what we have the luxury of doing every day, and I just want to put that in perspective. I'm going to ask Diana Brodeur to come up. What we've done is let's stop with the we. What the communications team has done is they've put together a portal to give updates on the bond. As Trent said, we're now at a phase where we have updates. A lot of this has just been kind of sitting, so it's sort of what we internally are doing. So I asked Diana to be up here to kind of give you an idea of what that looks like. You all will have this on your board portal, and you'll have a link directly to your board portal, and your board portal miraculously is getting more user-friendly. Our new vendor, I think, has allowed it to be more user-friendly, so it should be more helpful to y'all. But also, it's going to be a free site for anybody in the community to look at and get updates from. And I think it should be helpful. So we're going to put it up on the screen. But Diana, why don't you talk a little bit about it and what your incredible team did?
Sure. For those I don't know very well, my name's Diana Brodeur. I've been at JPS in communications for 3.5 years. And before that, I spent 2 decades as a TV news manager. And I am proud and happy to be here. We have put together a public platform to share, to capture all of the decisions and information about everything that's ahead for JPS. This is accessible for anybody, stakeholders, community members, and I'd encourage you all to share this with everybody, anybody who's interested in knowing what's going on here. You can access it by directly typing in yes2jps.org, and as Robert said, it is on the board portal on the homepage, with navigation tools to get there. Does anyone have any questions about what might be on there? As we go, as more decisions are made, as information becomes available, this is a live, living, breathing site. It'll never be completed. It'll never be in a finished state. We will constantly be working together, discussing elements of it, and posting so that everything's available.
Jeff, if you'd do me a favor, I think Jeff can hear. Jeff, if you'd scroll back up to the beginning of that so we can scroll back down through that again. We didn't want to, we certainly could have had it go live, but you see the first picture up there is our new cancer center. Mm-hmm. We've got testimonials from our patients, our employees, our physicians, and
for ease of kind of managing that content, and for ease of, as you share the story of what's going on here, we kind of grouped it by quarters, by seasons. So you'll see things are broken up as some priority issues as the years roll along.
Question I have, anyone can leave a comment if they go to
those stories are captured from our main website where people can comment, and so those comments transfer over. Mm-hmm.
Yep. The other thing that the communications team thought would be helpful for you all is you all, as board members, will oftentimes say, I really need some talking points, or I need something that's topical. I'm out, I've got a breakfast. Sometimes you can scroll through here in addition to our website, because our website has a vast amount of information for y'all, but this too can give you another insight into a few things that you can say or do when you're out in the public as well. It's just one more tool that we want to use for y'all, but in particular for those of you in the community. For any update that we have, particularly regarding the bond, that's where that's going to go, and it will be housed in the one area. You won't have to go through the entire website to figure out exactly where to go. We want to try to make it as easy as possible for y'all and anybody else trying to figure out, particularly as things get more hectic and busier with a post-bond situation. These updates will be very helpful. Pastor?
First of all, the first picture we saw was yours. You said that it was a building, but it was yours.
I wanted that part to scroll faster, but he scrolled slower on that one. Yes, sir.
But I'm John Q. Citizen at home.
Correct. Yep.
No, I can access this for info.
That is a great question. We are going to put out a communications campaign to teach people that this exists now and that this is the place that they can go. Again, that's yes-to-jps.org, and I hope we are able to canvass it widely enough where people are aware.
Yeah, because I was looking at it. Yeah, I'd like to get some kind of information that I could put in my monthly newsletter at my church that would direct them to pull this up.
You bet.
Be happy to work with you on that.
That's a great idea.
Dinah and the team and any of the rest of y'all that want that will work with you and tell you how to help your congregation in that regard. Dinah, thank you very much.
Thank you.
And Mr. Chair, that's all I have for the CEO report.
Well, it's a good way to segment into some other stuff, because I love the yes to JPS. That's a good one. We will move forward then down to the medical executive staff. I think Dr. Schrader's not here today. Robert, is there anything from the medical staff?
No, I don't think there was anything that came up. It was a fairly routine medical staff meeting.
Gotcha. We'll move to item number 8, which is the acclaimed physician group. I know Dr. Hotchper, I think Michael's there. He is. He's there. I know, you're normally, that's right. You're normally coming down this side. Yeah, you kind of tricky, Michael. Thank you. All yours.
Not a whole lot of updates for this month. Most notable is the Acclaim Executive Committee approved the appointment of Dr. Jocelyn Z. and Dr. Cheryl Hurd as members of the Physician Board. They are currently serving on that. They were originally on the board as replacement for other individuals, so now these are their own appointments, or for Dr. Z, her own appointment, and for Dr. Hurd, her second 2-year appointment. The Physician Board also renominated Dr. Z to continue to serve as the chair of the Physician Board, and that was also approved by the Acclaim Executive Committee. We have one open board position, which we are currently calling nominations for and vetting candidates. And so hopefully by at the very least, the September meeting, we'll be able to announce who that Physician Board member will be. We are about to embark on the recruitment for our permanent women's health service line leader. Dr. Carson Henderson is currently serving in the interim role and has really brought a fresh air and stability to the women's health service line. But we certainly want to go out and spread our wings and see if there are other candidates out there as well. We will be utilizing an external recruiting firm to help with that recruitment. Dr. Carson Henderson has been encouraged to apply should she wish, but our anticipation is we will launch that in and around September 1 and then begin to review candidates on an ongoing basis until we have identified that final individual. Lastly, I would just add that there has been an enormous amount of engagement and push by our providers and our clinical leadership to be heavily engaged and involved in a variety of different projects throughout the organization. And whether that is during this budget planning season that we've been going through, whether it's looking at our throughput throughout the hospital, But there is a readiness and a hunger by our physicians and our providers and our leadership to truly be at the table, to help be involved in process and protocol, and even in terms of how we grow and what core services we need to provide for our community. And so it has been a real delight over the last 14 months since I've been here to see that ongoing transformation, and it's something that I definitely wanted to bring to the board's attention and to give my own kudos and compliments to our physicians and our providers in that ongoing march to help deliver the best possible services we can for our patient population here.
Dr. Hochberg, any questions for Dr. Hochberg while he's here on the board? Any comments? Dr. Weber chairs that.
At the claim group, we did approve the Aetna amendment for managed care contract. But the other thing that you did not talk about is the number of positions that have been filled and that have contracts out there, because there's been a significant change in the number of family practice residents that are going to stay here and join a claim. And just from the discussions at the Claim Executive Committee, I want to congratulate Michael, Diana, the administration, et cetera, for how far they have come in a very short period of time in developing various key performance indicators for each group, each physician. The new Strata software will help considerably, I think, in managing physicians and what they do. They've done a lot of work, and Michael only comes up here for about 5 minutes, but they need to be congratulated, I think.
Well, I thank you for that, Chuck.
Now, which side are you going to sit? I mean,
I got to keep everybody on their toes.
Okay.
The next thing is I'm going to float out from the floor. That's what I'm hoping for at some point in time.
if you do that, I'll be real nervous.
Well, you start floating, we're going to add it to your resume. We haven't seen that
Yeah,
part
that's
yet,
right.
but.
Say I was coming from the heavens. I said I was coming out from the floor.
understand.
okay?
We've heard other, Michael. So anyway, Chuck, good comments. And as the board knows, the current chair and vice chair of this board sits on the Claim Executive Committee. So we have the pleasure of sitting through a lot of those meetings. And Chuck, your comments are well made. So again, if there's no comments, Michael, thank you very much.
Great, thank you.
Thank you very much. The next item is number 9, which is our committee reports. Dr. Emerson's already kind of fluffed up Mr. Montgomery because finance is first, and so before I
wasn't
call upon
trying
him.
to, but-
I know you're trying to help. I will ask, and I talked to, as we know, the budgeting process, we touched upon it in finance. We plan to do it similar to what we did last year. It seemed to work. If you look at budget to actual, we're tracking very close to that budgeting process. But again, I've asked Steve to make sure that that's where everyone can get their information and have plenty of opportunity to ask any questions prior to that. So Steve?
Yes,
you may
sir.
want to go
I
for
would
that. Thank you.
encourage that, what Mr. Chairman said. Sharon and her group are very, very much available to you, and they'll make themselves accessible. I would encourage you, especially the newer members, to engage her and her group as we get it closer and closer to the budget actually being presented to the board, just so you can know the parameters and sort of have some context before it's rolled out. And they're very accessible. We did have a great finance committee meeting on the 27th. For those of you who missed it, I'm sorry you missed it, but the May numbers are really fantastic, and really pleased with that, and everyone should be. And we have a number of contracts on the consent agenda as well. So Sharon will present the May numbers.
Thank you, Mr. Chairman. Sharon?
Thank you. And for those of you who are new, and even those of you who are not, the best way to ask a question is just call my cell phone. So you all have my number. If you don't, I'll make sure you get it. But I will always be accessible and can get you that additional detail. So that seems really small this month, but this is the consolidated income statement for May, and, we've only got about 4 months left in our fiscal year. As a reminder, we close our fiscal year on September 30th, so we are tracking really strong financials this year. From the hospital standpoint, we have about a $4 million operating income that far exceeds our budget. We had a couple of expense items that were some savings. We also had a insurance settlement, and we kind of, with some additional information, we were able to book several months of a new program. So those 3 items accounted for the positive variance on that. A claim also had a favorable month, about $500,000 ahead of their budget. And if you look at our month total, we are at $2.4 million compared to an expected loss of about 1.8. So again, very favorable. Year to date, that brings us for the medical center, $18.4 million. A claim investment is about $2 million favorable. So again, that is a huge contributing factor. And overall, we are at a positive $4.7 million. Again, if you look at the way that our system is structured, the physicians are an investment, and the medical center is designed to cover that. So when we get into a positive number year to date, that's really where you want to see it. Are there any questions for May? Okay, thank you.
Questions, Sharon? All right, Sharon, thank you very much.
That concludes
Chairman,
my
any other
report.
comments?
No, sir.
Always an excellent report. Sharon, thank you for everything. So the next item is the Governance Committee. Mr. Fisher's not here. I think I actually chaired that Governance Committee. There wasn't any major actions taken at that committee, so I don't think there's anything else to report. Which brings us to our next item, would be our consent agenda. And all that was presented previously on the portal. If there's anything we need to take off, we certainly would consider that. If not, I'd entertain a motion for approval of the consent agenda, which is item number 11 on the, have a motion by Reverend Emerson.
Second.
I have a second by Dr. Weber. All those in favor say aye. Aye. Opposed, no. Thank you very much. Which one?
The Aetna help,
Gotcha.
help,
That
Aetna
is,
help.
make sure we get it.
Yeah, Mr. Wayne abstains on Aetna help.
And you, I was going
And
to
I
say.
need to abstain from item E.
Yes.
Yeah, that's right.
I was
And
fixing
Mr.
to-
Montgomery needs
Thank
to
you.
abstain from item E.
Which he likewise did in finance. Yes, like they both did in finance also, so thank you.
We had you covered, we were helping you.
Yes.
Way ahead of numbers.
Anyway, which brings us to item number 12. Any legal reports, Mr. Adams?
Yeah, one item is for the month of May, there were 41 contracts under $500,000, though that list has been posted on your web portal, the board's web portal. If you got any questions, feel free to give me a call. That's it.
Which would now bring us to the point in our agenda. We do have to go to closed. It will not be very long. It should not be very long. Obviously, we need to discuss privileges in there. For those in the audience, we anticipate it not being very long. Obviously, we have to vacate the room for that, but thank you all for being here. You're certainly welcome to come back, because I don't think there'll be much after the consent agenda. So at 1:55, we'll take about a 5-minute pause for, then we'll thank you. Thank you very much. We'll now reconvene in open session at 2:10. The item of business before us is our approval of privileges. Dr. Elliott?
Thank you. So thank you very much, Chair Powell. I'm asking for the board for approval of the following privileges that you have there for the medical staff.
I have a motion by Dr. Simmons and a second by Mr. Zimmerman. All those in favor say aye. Aye. Those no. Thank you very much. Dr. Elliott, thank you very much. Is there any other business that needs to come before the board at this time? A reminder that on the 18th, we will certainly look forward to planning Trent and all that information. There being no additional business to come before the board, we stand adjourned. Thank you.